crisis and the pandemic that is facing the country, which has recorded the highest number of coronavirus cases since the outbreak of the disease after 447 more people tested positive. The government is warning that the disease is likely to spread exponentially as Kenyans drop their guard on safety guidelines. Our course reporter Kevin Mutai reports that 4 more people have succumbed to the virus in the past 24 hours, bringing the total number of fatalities in Kenya to 173.
The caseload of coronavirus in Kenya continues to surge since the first case was reported in March 2020. So far, the official number of those infected stands at 8,975. Out of the 3,803 samples tested in the last 24 hours, 447 people have been confirmed positive for COVID-19. The cumulative number of the country's total samples collected stands at 200,311. Nairobi leads with 318 cases, followed by Kiambu with 33 cases. Kajiado has 25, Nakuru 23, Machakos 18. Mombasa has reported 14 new cases, Uasin Gishu 7, Busia 3, Laikipia 2, Kericho, Makueni, Migori and Turkana counties recording 1 case each.
From a statistical point of view, 138 people at the moment test positive from every 100,000 sample ran in Mombasa, while in Nairobi, with a caseload of 4,554, it is 100 for every 100,000 people, which means, in effect, that in terms of the intensity of the disease, Mombasa is ahead of the other counties.
Health authorities are warning of tougher times ahead with the lifting of travel restrictions. The CS says the country is bracing for more community transmission.
We are not going to get to the position where we are carrying out mass funerals and mass burials using tractors to bury our dead, because there are so many that we can't cope. That is what happens by a runaway situation, as happened in Italy, as happened in New York.
Mombasa County leads with a total of 335 asymptomatic carriers who are currently under home-based care, as the ministry says 90% of the cases in the country do not require to be in hospitals.
One is that you must have a positive COVID-19 diagnosis based on a laboratory confirmation by PCR, polymerase chain reaction. Number 2 is that you must be asymptomatic. If you have a symptom, we'll take you to institutional care. Number 3, you must not have any coexisting medical condition like diabetes, hypertension, cancer, or chronic lung or kidney disease.
We have mobilized over 150 beds to deal with severe cases at the hospital. We have also mobilized some 300 beds at the local university, the Technical University of Mombasa, to deal with moderate cases of the disease.
The government also says that once international airspace reopens, any passenger coming into Kenya must be tested from their countries of origin and must provide a COVID-19 free certificate upon landing. The government is also advocating for personal responsibility, calling on the citizenry to abide by safety protocols. Kevin Mutai, NTV, Mombasa.